when preparing this work, I was sitting in my office with Adam Hamilton and Tracy Sue, our ITI scholar, and we had this conversation. And I was trying to tell them, the younger generation, I said, look, every dental implant, under normal circumstances, has a placement and a loading time. Otherwise, it's a failure, right? If you try to place the implant, you never placed it, or if you place it and you cannot load it, that is the definition of failure in implant dentistry. So therefore, these two elements cannot be analyzed separately. And this is what we have been doing for the last 15, 20 years. We look at the placement protocols on one side, and we look at the loading protocols on the other side, without ever cross-linking what these two aspects of the same treatment would look like when you put them in the same format. So when I was invited to write this paper for the systematic review, I said we need to have a team of prosthodontists and surgeons in this group so we can really tackle the problem comprehensively. I'm going to show you the dynamic of our group during the consensus conference, because this is very interesting to mention as evidence of the development of this paper. So, as you can see here, this is the pros segment here, and this is the surgical segment here. Day one, no talking, right?